All right. Good afternoon, South Coast. Hope everyone's doing well. It's Friday. We're continuing our discussion with some of the doctors at South Coast Health. Joining me today is Dr. Michael Barretti. He's an MD at South Coast Health, and we're going to talk about COVID-19, his experience with it, and vaccines. So welcome, Dr. Barretti. Just tell me where you're at today and a little bit about yourself.
Thank you very much. I'm actually at home today. I left work a little early to come home and do this. I am a pulmonary and critical care physician. I'm an interventional pulmonologist and the director of the medical ICU at St. Luke's. I've been with South Coast just over 7 years, trained at UMass Memorial Medical Center, spent a lot of time active duty with the military as a physician, and now I'm still living in Central Mass, but I've been working down in the South Coast region for 7 years now.
Oh, nice. I'm a retired major in the Air Force, and so it's nice to
Great.
be a military guy.
Wonderful.
Yeah, so you have a unique experience, and I know a lot of people have gotten COVID, but you're a doctor who has gotten COVID. Just tell me about your experience with it.
It was during the first wave when it was all still very new and scary, and no one really knew what we were dealing with. I'll be honest. Everyone was online like every other doctor in the country, trying to figure out what the best way to treat this was and what the best personal protective measures were. South Coast did a great job in supplying us with all the PPE that we needed. But it's tough to nail down exactly where I got exposed, but I'm sure it was at work because it was the only place I really was for months on end. And there was one patient in particular. I remember I spent upwards of 3 or 4 hours straight in his room, and despite the PPE, I think that it was just enough of a viral load to get me sick regardless. It was a really scary experience. I was in denial for the first couple of days. Working in the intensive care unit, started off with just an earache and a stuffy nose, and I said, I get allergies every year this time. It's not a big deal. Then the low grade fever, and I was working an overnight shift, and I woke up the next morning in the hospital call room, dripping in sweat and really feeling awful. And I told everyone at work, I said, I'm going to go get tested and go home. And I was off for a few days, and the initial test came back negative, actually. And I thought I was just a sinus infection or whatever, an ear infection. And things went from bad to worse. Fevers of over 103 for about 2 weeks that I couldn't break. My wife actually got sick from me, and we had to send our kids away to our in-laws for a couple of weeks to keep them out of the house. They luckily didn't get sick. I was lucky, as severe as my infection was, just horrible malaise and fatigue. I couldn't get out of bed. I couldn't even have the strength to roll over and get something to drink. And I got dehydrated pretty bad and ended up admitted up at UMass Medical Center in Worcester, near where I live. And that was a really scary experience, going into a hospital knowing that's why I was being admitted. And it really drove home what all the patients have gone through, in the last 1.5 to 2 years. So it was an eye opener.
Yeah, so you're someone who has got COVID. You actually got COVID. I've never got it. So you got COVID. You treat people with COVID. So we have this vaccine. So have you gotten vaccinated, and why? If so, why is it important?
Yes, I've been vaccinated, and I'm due to get my booster very soon. I would get vaccinated every week if that meant that I had less of a chance of getting this again. The natural immunity is presumed to help. The vaccine has been proven to reduce the spread of the disease and the likelihood of getting serious illness. We do see breakthrough infections. We see breakthrough infections with every vaccine out there, the flu included. But the most important thing is that having the vaccine prevents you from getting the severe form of the illness, and it works. It works, and I can say that because in the intensive care unit now, the only people we see with severe illness are unvaccinated patients. And that has really changed the face of how we see this from the ICU perspective. People that have made the decision to not get vaccinated, unfortunately, do run the risk of severe illness and death from this disease. We do have some people with some moderate infections with the vaccine, but they do better. They just do, and the vaccine is credited with that.
Yeah, I think the big misinformation on social media, and I deal with it every day in my business, is, look, someone got the vaccine and they got COVID. And I try to explain to them, and I've talked to a lot of doctors, is the vaccine boosts your immune system. So you can get COVID, but it's really how severe does COVID turn into? And that's really the part. So like people use, and Baker explained this pretty well, they use the Cape Cod, Provincetown example, after 4th of July, when it rained and everyone got forced inside, where most people who were immune got the vaccine, got COVID. But I try to explain to people, yeah, 800 people got COVID, but only 3 went to the hospital because they were all mostly vaccinated, right? So just because you get COVID doesn't mean the vaccine doesn't work.
It's true. And where everyone's still learning about this disease. It's been almost 2 years, and we're still learning what it does to us and what it does to us long term. And people get the flu every year after getting their flu vaccine. It's the same concept. The vaccine boosts your immune system, and like you said, it determines how your body handles infection. And you don't want to deal with this the first time, saying the words that so many of my patients have said to me right before they go on a ventilator, which is, "I wish I got the vaccine." And I've heard that time and time again.
Yeah, I've talked to some of the leading virologists from South Coast, and they explain the safety of the vaccine. So from my understanding, you have these breakthrough cases, obviously, but some of the effects from getting the vaccine, it's like 1 in 800,000, 1 in like 500,000. And usually it's not death, it's something like a blood clot or something like that. Can you explain the safety of the vaccine?
So, very rarely have we seen a vaccine come out this quickly, and people are rightfully skeptical of that. I mean, I think everyone was, and that's okay. But based on the sheer numbers of people that have received the vaccine worldwide, and believe me, the media is all over the complications of this vaccine and are the first to report it. And there are complications of every vaccine. But the complications of this vaccine have not been any more prevalent than complications of other vaccines. And, I think you have a better chance of hitting the lottery than to have a serious complication from getting this vaccine. Now, the side effects of the vaccine are real. It doesn't feel good. Myself and most other people I speak to, about a day to 2 days after getting the vaccine, there are some flu-like symptoms. It's not an infection. It's your immune system ramping up. No one gets hospitalized with those symptoms. I took a little bit of Advil and laid low for a day, and they went away. And almost 24 hours after I got them, they disappeared. So
yeah, I got the Moderna, 2 shots, and each shot gave me kind of some soreness on my shoulder and a little bruising there, and it lasted for, I wouldn't say about a week, but that was the worst that I got. And I've heard some things like they took down the Johnson & Johnson vaccine from just like 3 cases of some kind of adverse effect, and they looked it over and they went back to bringing it back out there. So they're overly cautious in my view. I think they're too cautious, but it is what it is. So you're in the ICU. If you can just explain, like, I want you to reinforce that point. The people that are getting the most severe illness from COVID are the unvaccinated.
absolutely, absolutely. Since the vaccine has been so available and so well received, the only people that are making it to our intensive care unit, barring 1 or 2, have been unvaccinated patients. And the 1 or 2 that have been vaccinated have done better than the ones who have not.
And sometimes it's because of comorbidities and elderly. And I know, you get a vaccine. There's a reason why they have booster shots, right? Because people that are more adverse risk, and then your immune system's, this is something that's kind of like a flu shot. You can't just get it once. It's not like smallpox. You get it once and you don't have to ever, get another shot. This is something that might be an annual thing, and your immune system wanes against the vaccine. So that's why there's a booster shot, right?
Yes, absolutely. I think that as much research as can possibly be done on a vaccine has been done on this vaccine, and monitoring antibody levels in people over time of different groups, high risk communities, elderly communities, comorbid communities, have benefited from the booster shot in keeping their antibody levels high enough to offer real protection against this virus.
So you said you're going to get the booster. So the booster, I'm guessing, is for medical professionals and elderly and other people that might have pre-existing conditions. Is that right?
Exactly. High risk personnel, medical personnel, elderly, and people with comorbidities, immunocompromised patients are the first ones being offered this booster shot, and for good reason. After that, it will be most likely approved for the general public.
Yeah, so I'm going to I have it in the description, but I'll put it's southcoast.org/COVID-19 dash vaccination. So you can still schedule yours. Obviously, you can still go to the the pharmacies like CVS and Walgreens. We post on New Bedford Guide these pop-up things that happen throughout the city of New Bedford and other places. So this is the best place right now to go to the website and actually schedule your vaccine. Would you recommend?
Absolutely. And you do not have to have a South Coast provider to come to South Coast for the vaccine. And yeah, that's the best site to go to for your information and to get your vaccine.
So I'm going to see if I got some questions here I can pull up. So Brianna, I guess talking about what you had. So how did you find it was positive? It came back a negative result.
As I got more sick and I brought myself to the hospital, or got a ride to the hospital, I should say, I was retested at UMass and it was positive at that point. So the initial test, and again, the testing was, how quickly can we get as many tests out there as we can to try to screen who has this disease? There were false positives, there were false negatives. My symptoms were consistent with it. My first test, probably 3 days into my symptoms, was negative, but by the time I was admitted to the hospital, it had turned positive.
Yeah, and Lisa says the problem is that people do not believe this is real. I lost a friend and Dr. Tosi to this, but people don't listen. And that's why we do these interviews. You can read what you want to read on social media. You can go to website, but we want to bring the doctors, and we brought in, this is probably the 7th or 8th doctor we've talked about vaccines and COVID, because, and see if you agree with this, doctor. I tell people, don't trust us, call your own primary care, because they know you better. And if you want to hear it from someone, maybe you've had a doctor for 20 years, call them and get the information if you don't want to believe us.
Absolutely. There is a lot of misinformation out there, and your doctor knows best. Your doctor knows you best. And I'm so sorry, I'm getting some text. There we go.
I think you can talk. I think we lost your video part.
Okay. There we go. Sorry about that. Is that better?
Yeah, you're good.
Okay, good. So yeah, speak to your doctor. Try to ignore the information that we're getting on social media sites. That information is not vetted. That information is not always accurate. This is not a conspiracy amongst healthcare providers. This is not a money-making issue with the vaccine. These are doctors like myself who have seen the effects in real time of what this disease does to people. And we're going to give you the accurate information from a medical perspective. It's going to be your choice whether or not you get vaccinated. Everybody is going to make their personal choice, but hear the stories from the people who have been on the front lines and the people who have had the disease, and ask them, what do they think of getting a vaccine? And I can't imagine there's somebody out there that's had COVID that wouldn't be the first to recommend a vaccine to everybody they know.
Yeah, some of the key points I just like to constantly bring up to people is people really have to, I'm now getting a phone call. So people really have to understand that, the vaccine does not put a force field around you and prevent you from getting COVID. It actually mitigates the health consequences if you do get it. That's one of the key things out there.
Yes.
Talk to doctors, not social media experts. They're the ones who give you the best information possible. And if you're still, adverse from getting the vaccine, just go to the right websites and talk to your doctors, and hopefully you can get the right information and make the best decision possible for you. But no, if you don't get the vaccine, I'm talking right now to an ICU doctor that's telling you that the people that are seeing the worst condition from COVID are the unvaccinated. So it's something to really consider out there if you're not vaccinated yet. Absolutely. All right. So I'll let you close and then we'll end the discussion.
I appreciate that. This has been a great forum, a great opportunity to get some word out there about this. And like I said, ask your doctor if you have any questions on whether or not this vaccine is right for you, and whether or not they recommend it. Take this seriously. This is not a conspiracy. This is not a hoax. Any doctor who works in the ER, the inpatient setting, or the intensive care unit will tell you firsthand, this is real. Take it seriously. Consider getting vaccinated. There's treatments out there being talked about online that have gotten, press one way or the other, ivermectin and whatnot, it seems counterintuitive to me to consider an experimental treatment over an FDA-approved vaccine. I think that it makes much more sense to go where the research has led us, and right now the best chance we have of defeating this is to get vaccinated.
Yeah, I think that what you said is key. I hate that it turns into a political thing, and that's what it really, I think, the unvaccination has become. Yeah, FDA approval, and all the doctors I've talked to, they really have brought up a point when people say, "Hey, this is a new vaccine. It's not new technology that developed this vaccine. We've never had governments put all their resources behind anything like this before." Kind of like the mission to the moon we had with JFK. We just never had that, and technology improves, and it's not something that just came out of nowhere. So I appreciate your time, doctor, and hopefully people found this informative. And I ask you to share this with your friends, share your people that are skeptical, let them watch this kind of video so they can get the right information. So enjoy your weekend, doctor, and everyone out there.
Thank you very much. I appreciate the time.